Today we will be doing an instructional video on showing you how to set up your heated trach collar mask using your 50 psi. Here are the items you will be needing to do your setup. Before touching any of the supplies, make sure to thoroughly wash your hands or use hand sanitizer. First, you will be needing your 50 psi compressor, your heater, your water chamber, your water trap or drainage bag, your concha adapter, your pressure line adapter, which will be used if oxygen is needed, your elbow adapter, your Christmas tree, your trach mask, your corrugated tubing, your nebulizer kit if nebulizer treatments are needed, 7-foot oxygen tubing, and 25-foot tubing. This clip will be showing you what you will be seeing on your 50 psi compressor and your heater that will be delivered to you. First, we will go over your compressor. In the front of your machine, you will have your on and off button. Above this will be your filter, also called a donut filter, which will also be provided to you. Above that will be your dial to adjust your pressure if needed. This will be your pressure gauge where you will be able to see the pressure when adjusting the pressure. This will be your reset button in the event of a power outage and your compressor connector. On your heater, you will have your on and off button. Next to your on and off button will be the button to select the setting for the amount of humidification that is needed for your patient. The first being the least amount of humidification and the third being the most. There are 3 different settings. On this side of your heater will be a light that will light up if you have any malfunctions with your heater. You would then call somebody here at Aviana to have your heater exchanged. On the top of your heater will be a plate which will be heating up and will be heating up the water to provide for your trach collar. Please be careful not to touch this plate because it will be very hot. This clip will be describing how to set or adjust your pressure on your compressor machine. You will be needing your Christmas tree adapter. You will then thread on your Christmas tree adapter into your connector on your compressor. You will turn your machine on. You will include the hole on your Christmas tree adapter and check to see where your pressure is set at. If your pressure is needed to be changed or adjusted, you would then pull out your dial and turn to the left or right, depending on how much pressure is needed. Recommended pressure is between 20 and 30. Once you have your pressure set, now you can connect your trach collar. This next clip will show you how to set up your 50 psi trach collar heated. First, you will be given your water chamber that is provided to you. You will receive this with blue caps on the top. You want to make sure to pull this off and take these caps off. You will then slide your chamber onto your heater. You want to make sure to pull down on this clamp and align, making sure that both sides are in. Once it is in, you will hear a click, knowing that your water chamber is incorrect. Next, you will need to connect your elbow adapter and your concha adapter. When connecting this, you want to make sure to connect your concha adapter to the smaller end of your elbow adapter, making sure it is tight and secure. You will then place the larger part of your elbow adapter to the top port of your water chamber. You will then grab your 7-foot tubing that will also be provided to you. One end will be connected to your concha adapter, and the other end will be connected to the compressor on the Christmas tree. Next, you will be having to connect your corrugated tubing to your water chamber. We will be providing you with 100 feet of tubing, so this will need to be cut to the length that is needed from the machine to the patient, allowing some slack for movement. Once you have cut your recommended length, you will then attach one side of your corrugated tubing to the top of your water chamber port. On the other end, you would connect your trach mask. Now you would go through your tubing midway and cut to be able to place your water trap in between. Once you have found midway, you want to make sure also that you're cutting the tubing on the flat surfaced part, not on the rigid part. You would then grab your water trap and attach one side to your tubing and the other side to the other side of your tubing that you have just cut. Your bag will have a little port that you will be able to empty out once your bag is no more than halfway full. Next, you will be having to connect your corrugated tubing to your water chamber. We will be providing you with 100 feet of tubing, so this will need to be cut to the length that is needed from the machine to the patient, allowing some slack for movement. Once you have cut your recommended length, you will then attach one side of your corrugated tubing to the top of your water chamber port. On the other end, you would connect your trach mask. Now you would go through your tubing midway and cut to be able to place your water trap in between. Once you have found midway, you want to make sure also that you're cutting the tubing on the flat surfaced part, not on the rigid part. You would then grab your water trap and attach one side to your tubing and the other side to the other side of your tubing that you have just cut. Your bag will have a little port that you will be able to empty out once your bag is no more than halfway full. This next clip will show you how to connect your oxygen if oxygen is needed, or connect your nebulizer treatment if nebulizer treatments are needed. First, you will be provided with a pressure line adapter. You will connect this adapter in between your corrugated tubing and your port of your water chamber, making sure it is tight and secure. Your pressure line adapter will have a small port sticking out where you will connect your oxygen tubing. The other end of your oxygen tubing will be connected to your home oxygen system or your concentrator. If nebulizer treatments are needed to be given to your patient, you will be needing your nebulizer kit that we will also be providing you. In your nebulizer kit, you will only be needing your T adapter, your neb cup, and your nebulizer tubing. Your spacer tubing and your mouthpiece will not be needed. You will connect your T adapter on the end of your corrugated tubing, and you will get your trach mask and attach your trach mask to the other end. You will get your nebulizer cup, opening your lid, filling it up with your prescribed medication, and making sure your lid is closed securely. Then you will attach your cup to the T adapter, making sure that is also tight and secure. You will then use the end of your nebulizer tubing and attach that to the port on your nebulizer machine. And now you are ready to turn on your nebulizer machine and give your nebulizer treatment. Next, we will show you all of the supplies and how many you will be receiving. First, you will be receiving your water chamber 2 a month. You will be receiving 2 water traps a month. You will be receiving your Christmas tree, your pressure line adapter if needed, your concha adapter and elbow adapter once a month. You will be receiving your 7-foot tubing once a month. You will be receiving 25-foot oxygen tubing once a month. You will be receiving your nebulizer kit if needed 2 a month. You'll be receiving 4 trach masks a month and a box of 100 foot of corrugated tubing every 3 months. You will also be receiving your donut filter if needed to be changed. Some important reminders is to keep all of your equipment clean before and after use. All of our equipment is tagged with a sticker providing you with information if you need to reach out to somebody. If you have any issues with any of your equipment, please feel free to reach out for further assistance. Properly dispose of all your dirty supplies. Please remember to fill your water chamber with distilled water. If in the event you do not have distilled water, you can boil water. Remember to empty out your water bag once halfway full. Keep the pressure on your compressor between 20 to 30. Remember to place your water trap midway from your patient to your heater, allowing your corrugated tubing to be able to trap your water. Use your green Christmas tree adapter to check your pressure. Your recommended start setting on your heater is 2. This can be adjusted for patient's needs. If your donut filter needs to be replaced, feel free to reach out to let us know and we can have one shipped to you. Thank you for watching. If you have any questions or concerns, please feel free to reach out to an RT here at Aviana.